Ghana regularly experiences outbreaks of diseases such as cholera, meningitis, and most recently the ongoing COVID-19 pandemic. Epidemics lead to morbidity and mortality, affects the livelihoods of individuals and households, collapse business, and stall the growth of the economy.
We could see that with this COVID-19, it has ravaged several economies, and most of it is because we were ill prepared, especially in the developing parts of the world, in Africa especially. So if you are not prepared for epidemics, it will take you unawares.
The infrastructure in Ghana to respond to epidemic was extremely minimal. The financial commitment, the human resources, the systems. So that is why St. Ghana decided to seek financial support to be able to advocate.
In light of this, St. Ghana and Global Health Advocacy Incubator partnered to undertake a series of activities to advocate towards increased domestic investments in epidemic preparedness at the national and district levels and support the COVID-19 response in Ghana. St. Ghana identified, engaged, and trained national and district champions to advocate for EP financing and tackle COVID-19 vaccination hesitancy issues. They also collated key issues to submit to the Ministries of Finance and Health and 8 district assemblies towards influencing prioritization of EP financing in the 2022 budget and medium-term development plans.
Following Ghana's evaluation of our international health regulation capacities, Ghana has capacity issues or concerns around the availability of financing to respond to epidemics.
Because we were not prepared for it, it got us by surprise. We were not having the fund to be able to buy PPEs, that is personal protective equipment. We're not also having resources to carry out public education to create awareness on the COVID-19 cases. And then again, we're not also having the fund to buy fuel for the security agencies to enforce the social or COVID protocols.
Basically, our source of funding for epidemic is usually the District Assembly Common Fund. But if you look at the District Assembly Common Fund, the way it comes, you just agree with me that it's not more common as it used to be, because you have several quarters that they've not sent money for your activities. So in case there is an epidemic, that's where the challenge might be.
We all saw what happened, how it crumbled world economies. Ghana is no exception, where it affected almost every aspect of our lives, and even what we plan doing starting from 2020 to date are seriously affected, because monies that were supposed to be used to do development are rather channeled into this epidemic education and how to contain such epidemic.
If we look at the action plan of the District Assembly, we no longer have a room for miscellaneous. So therefore, there is a need for us to have epidemic preparedness and financing plan in place, so that in case there's an outbreak, then quickly we dwell on that plan to implement.
One of the key things is that as a country, with the help of US CDC, WHO, we have been training people, because human resource is very important. We have what we call the Field Epidemiology and Laboratory Training Program, where we have trained people who can respond to outbreaks adequately in Ghana and other parts of Africa. These human resource capacity should be prioritized, and most of the funding is from the development partners, WHO, US CDC especially. So Ghana government should put in money for this training, so that we will have adequate human resources, strong health systems, so that when these things happen, we will be able to respond adequately, that we will always not be begging for support.
We need to continue to advocate so that the commitment that government has made can be translated each year into finance, into actual budget.
Even when this project is over, we would be using our advocacy as an organization to keep reminding our government that every year there should be a budget allocation for epidemic preparedness.